We've been talking a lot here about how bad the flu season is this year, and this week the CDC reported 22 more children have died, 84 so far this season. Our chief medical correspondent, Dr. Jon LaPook, joins us with more on all of this right now. Jon, first of all, what do you make of the latest numbers you've seen, and where are we in the flu season now?
Well, they're disturbing numbers, of course, but we may be seeing a glimpse of the beginning of the end of flu season, right? If you compare this season to the one 3 years ago when we had that same nasty H3N2 strain that's such a problem this year, by this time, back then 3 years ago, we saw the numbers going up and then coming down. But this season, the numbers went up and up and up, and finally this week, they started to level off. What that means is a leveling off of the number of emergency room visits for flu, and finally, the percentage of deaths from influenza have just started to drop. They've gone down a little bit. And the bottom line here is there's still at least 8 weeks potentially left in the flu season. The CDC is saying, make sure you get the flu shot.
We saw that number from a Canadian study saying that the flu may have been only effective 17% of the time in one strain. Yeah. The numbers here that you're getting are better than that.
They are, and they were they're still not what we want them to be, but overall, about a third of the people who got the flu vaccine were protected against the flu. But Jeff, in kids under the age of 9, almost 2/3 of the kids who got the vaccine were protected against influenza.
A lot of it depends on how old you are in terms of
under the age of 9 was really when it was most effective.
Okay, and then the other question here, which has been talked about a great deal, and I believe you think should be, is the potential for this universal vaccine and how far away we might be.
That's huge. Okay, so what's the problem with the flu vaccine? Well, the problem is that the flu virus itself every single year changes. So every single year we have to make a new batch of flu vaccine, and everybody has to get it every year. Well, they've done some research to find a part of the flu virus that doesn't change. And so they're making a vaccine against that part that doesn't change, and the potential is that you'd only have to get one shot every several years, and of course it could be much more effective.
But we don't know how far away that is.
I spoke to Anthony Fauci, who's the head of vaccine development for the National Institutes of Health. He said it could be within 5 years.
And that would be an enormous step forward for you and all medical professionals.
Think about it, Jeff. We could stockpile vaccine, and it would be so much more effective. We wouldn't have to be chasing it year after year. It changes, we change. It changes, we change.
All right, doctor, thanks very much.